Choose a clean table and wash your hands before testing. Find a gap in the package and tear the bag open in the direction of the gap. Reagent strip. Certificate of inspection. Nasal swab. Sample extraction tube. Read the user manual carefully before test. Tear open the foil bag of the reagent strip and place it on the table. Remove the nasal swab. Gently hold the nasal swab. Insert it into the nostril. At 2.5 cm, 1 inch, from the edge of the nostril, roll the nasal swab into the inside of the nostril more than 5 times. Repeat the same action on the other side. Remove the sealing film from the top of the sample extraction tube. Insert the swab into the sample extraction tube and squeeze the bottom of the sample extraction tube as slowly as possible 5 times for 2 seconds each time. Remove the swab while squeezing the bottle of the extraction tube to remove the liquid. Place the drip tip tightly over the sample extraction tube of the open film. Hold the extraction tube vertically and add 4 drops of treated sample into the sample port. Reaction time 15 minutes. Do not handle and move samples until 15 minutes have elapsed. Read the results. If the presence of 2 lines, the blue control line, C, and the red test line, T, both within the result window indicates a positive result. Any shade of color in the test line region, T, should be considered positive. If the presence of only a blue control line, C, within the result window indicates a negative result. If the blue control line, C, is not visible within the result window after performing the test, the result is considered invalid. Some causes of invalid results are because of not following the directions correctly, or the tests may have deteriorated beyond the expiration date. It is recommended to retest the specimen.